be
Recording in
serving
progress.
as chair for this evening. We have two other members with us tonight. I'm going to call on those members individually, and at that time, I'd ask that you say that you are present. Board member Susan Higgins.
Present.
Board member Justin Jordan.
Present.
Okay, I want to remind everybody that the meeting is being recorded. We have one item on the individuals that have stated that they want to provide test. That you've provided matches your screen name, so we know when to who to unmute. So those are some basic rules of procedure here for tonight. Again, the meeting is being recorded, and I would now turn it over to Bill Burke, Health Director, for a description of the order that is up for our consideration tonight.
Thank you, Chairman Alpine. My name is Bill Burke, as mentioned, the Public Health Director for the City of Beverly. At the same time, I'll read the proposed face covering order, and IT is helping us out, and they'll be providing it on the screen so people can see it from their viewing location. So it's a couple pages long, so I'll read it briefly. Indoor face covering order. Whereas the Board of Health of the City of Beverly has determined the threat of COVID-19 continues to pose a present, real, imminent, and ongoing danger to public health, safety, and general welfare of the people of Beverly. Whereas the annually recurring time period characterized by the prevalence of outbreak of influenza, otherwise known as flu seasons, occurs in fall and winter. Whereas the Center for Disease Control believes that both influenza and COVID-19 viruses will be spreading this flu season. Whereas COVID-19 variants continue to emerge, which are more contagious and resulting in increased risk of infection and transmission. Whereas the Massachusetts Department of Public Health on December 21st, 2021, issued a winter advisory regarding face coverings, advising that all residents of the Commonwealth, regardless of vaccination status, wear a mask or face covering when indoors and not at your own home. Whereas the daily infection rate in Essex County is continuing to rise significantly, and appropriate steps must be taken to mitigate the risk of transmission and protect the health and safety of city residents and visitors throughout safety measures addressing commercial, recreational, and social activities. Now, therefore, pursuant to foregoing MGL Chapter 111, Section 31, Section 104 and 122, 310 CMR 11.05, 105 CMR 300.200, and all other authorizing statutes and regulations acting by and through its agent authorized under Mass General Laws, Chapter 111, Section 30. We, the Board of Health of the City of Beverly, hereby order the following. 1, face coverings that cover the nose and face are required for all individuals, including employees, regardless of vaccination status, age 2 years and above, except where an individual is unable to wear a face covering due to a medical condition or disability. In all indoor public spaces, whether publicly or privately owned, including but not limited to restaurants, retail establishments, bars, performance venues, social clubs, event spaces, lodges, lodgings, places of religious worship, funeral homes, grocery stores, pharmacies, and municipal buildings, including schools. Food service establishment customers may only remove face covering when seated and actively consuming food or beverages. Indoor bar and dance customers may only remove face coverings when seated at tables or seated at a bar and actively consuming food and or beverages. Patrons standing or ordering at the bar must be masked. Patrons on the dance floor must be masked. 4, indoor performance venue customers may only remove face coverings in the actual act of eating and drinking if permitted in the venue. Lodging guests and workers are required to wear face coverings when inside hallways and common areas. Residents and employees of multifamily dwelling units are required to wear face coverings inside hallways and other common areas. Building management shall post notice of this requirement at all entry doors in the building and common areas. Fitness center, health club workers, members, customers, and visitors are required to wear face coverings during fitness activity, including strenuous activity and group activity, and while in locker rooms. at personal service establishments, including but not limited to barbershops, hair and nail salons, massage and bodywork establishments. All customers and workers are required to wear face coverings except for skin or beard care that occurs on the face, where the customer may temporarily remove the face covering but must immediately put the face covering back on for the remainder of the visit. Face coverings remain mandatory for all individuals on public and private transportation system, including ride shares, livery, taxis, ferries, and buses, in healthcare facilities and other settings hosting vulnerable populations, such as congregate care settings, as directed by the governor and the Massachusetts Department of Public Health. Nothing in this regulation shall affect any state and federal orders already in effect in Massachusetts relating to COVID safety. All entry doors to businesses open to the public must display notice advising customers and staff that face coverings must be worn inside the establishment pursuant to this order of the Board of Health. Establishment management shall enforce this requirement with respect to their staff. The Beverly Board of Health and authorized agents pursuant to Mass General Laws, Chapter 111, Section 30 and 31, are authorized to enforce this regulation and, if necessary, may do so with the assistance of the police department. 13, whoever violates any provision of this order may be penalized by non-criminal disposition processes provided by Mass General Law, Chapter 40, Section 21D, and the city's non-criminal disposition of violations ordinance. Article 2, Section 1 through 6, if non-criminal disposition is elected, then any person who violates any provision of this regulation shall be subject to, for the first offense, a penalty amount of $100, for a second offense, a penalty of $200, and for third or subsequent offense, a penalty of $300. Each day, a portion thereof shall constitute a separate offense. If one or more, each condition violated shall constitute a separate offense. 14, notwithstanding the foregoing, agents and officers of the Board of Health are encouraged to educate offenders and to exercise their judgment on a case-by-case basis, and they may, at their discretion, issue verbal or written warnings. This order is effective at 12:01 on January 6th and shall remain in effect until further notice is given. And then and just the signature page after that. So that is, Mr. Chairman, that is the proposed draft face covering order. I will continue, if you'd like, with some additional comments previously provided to the board. I had given Beverly's numbers regarding laboratory confirmed positive cases, incidence rates as reported in the Massachusetts Virtual Epidemiological Network, known as MAVEN. Their cases per 100,000. And I'll just, I won't get into the whole text, but I'll just hit the highlights. The dates are 11/22 to 1/2/22. So what we have seen, there's a 7-day incident rate and a 14-day, and they overlap. So just for an example, on November 22nd, a 7-day incident rate was 54.26 per 100,000. The 14-day was 47.13. 12/6, that increased to 78.96 for the 7-day, 62 for the 14-day. 12/13, 7-day was 72, 14-day was 78.44. 12/20, 7-day was 65, 14 was 69.91. 12/27, 7-day was 77.91, 14-day was 73.07. And this past week, the 7-day was 171.48. And 14-day was 125.57. So I know it was a lot of numbers, but it just kind of shows a trend of how cases are escalating. And I just wanted to make a note about that information is a majority of the, this is for the confirmed cases that come through the state's reporting network. So those are tests that you do at some of the testing sites. But a note to keep in mind, the majority of the home tests, including the ones most recently provided to Beverly residents that were either purchased by the city or were provided by the state, do not have a reporting mechanism. Thus, positive results for these individuals are not included in the incident rates I just mentioned. I just wanted to add on another note, other North Shore communities have adopted similar orders, including but not limited to Marblehead, Swampscott, Lynn, Salem, Peabody, Danvers, Rockport, Essex, and Gloucester is considering kind of at the phase we're at. And I just wanted to say, I know the board knows, but for the purpose of our audience, that I did provide the board with all the received email comments that we received not only prior to this meeting, but prior to the next meeting. The last thing I want to just read into the record, Mr. Chair, is we weren't able to have an attendee from the hospital. We did receive a letter from Tom Sands, the president of Beverly Hospital, and it's dated January 4th. Oh, it's on the screen now. Dear Mayor Cahill, as a healthcare organization and major employer in the area, we ask the public to stay vigilant in their efforts to help slow the spread of COVID-19 virus, given the recent increase in COVID-19 cases linked to Omicron and Delta variants. As Beverly Frontline Healthcare Provider, we express our strong support for residents to wear masks in all indoor settings outside their own homes, regardless of vaccination status, and for the duration of the Omicron surge. Vaccines are another critical component of our fight against COVID, and we urge everyone to get their COVID vaccination and booster. Other steps we can all take to protect each other include staying at home when you're sick, practicing good hand washing, hygiene, and wearing masks around others when required. We extend our deepest gratitude to all the dedicated healthcare workers in Massachusetts who are working tirelessly to care for our communities. Across Beth Israel Lahey Health, we are working around the clock to support patients who need us while continuing to keep our employees and patients safe through the pandemic. Sincerely, Tom Sands, President. So, Mr. Chair, that's all I had for entry into the record and for common points we wanted to get across. Thank you.
All right, thank you, Director. At this time, we're going to begin the public comment period. This is not a public hearing, but at the board's discretion, we are allowing up to 30 minutes for public comment on the order with a 2-minute limit for each speaker. This has been set forth in the agenda, the immediate announcement, I believe. This is a time for comment only. It's not intended to be a question and answer. And again, this is a public meeting, not a public hearing. As stated on the agenda, we're limiting it to Beverly residents or Beverly business owners or operators. And they have notified us in advance that they want to speak at tonight's hearing. I believe there is 14 individuals that have signed up. I will recognize them in the order that they are signed up or they have signed up. And we will then begin with the public comment period. Again, 2 minutes. After you've completed your 2 minutes, you will be muted. Again, please be reminded that this is being recorded. So at this time, I'm going to read names of individuals that have stated that they want to speak tonight. I will do my best to pronounce your last name, but I can't guarantee that in all situations, so please forgive me.
Excuse me, Chair.
Yes.
On a technical comment to let people know, as they approach the last 15 seconds of their comment, they should be hearing a chime. Another chime will ring when the 2 minutes have expired. We've also noticed that all of our participants who were registered to comment, we can see all of them except a Mike Reardon. And for Mike, I'm going to have to assume if he doesn't log in that it may be Tracy, and she can let us know if that's wrong. Thank you.
Thank you. So with that said, the first person that we're going to call is Mary Riley.
I am no
Hi.
longer see.
Okay, I'm finally here, I think. My name's Mary Riley. I'm a resident of Beverly. I live at 14 Prospect Street. And I just felt like I needed to chime in, given what has been occurring at the last meeting. First of all, thank you for the effort you put into creating this document. And I want to state that I fully support the mask mandate. Just a few personal reasons. I realize nobody likes wearing masks, but I don't want to get infected by either Omicron or Delta. And remember, the Delta is still with us, and I do not want to infect others. Although my husband and I are both healthy, we're both over 65. I think others, and I include those who probably support the mandate, would agree, I'm less likely to enter a business that does not have a mask mandate in place. Kudos to those businesses that have chosen to require masks for the sake of their employees, as well as the public prior to any mandate. As for personal freedom, please consider that those of us who support reinstating an indoor mask mandate have a right to remain healthy. Please consider your impact on others. The faster we take precautions through masking and vaccinations, the faster we'll get out of this COVID mess, which is truly what we need to get back to normal. Remember, the mask requirement isn't forever, and it'll cease once it makes sense to terminate it. Thank you all for your service on the Board of Health, and I'm done with my comments. Thank you.
Thank you. Our next speaker is going to be Dr. Erin Acevedo. I still see Mary Riley. Ross. Okay, Dr. Acevedo, thank you.
Hi, I'm Dr. Erin Acevedo, chiropractic physician. I've been practicing in Beverly, Massachusetts for 15 years. I've been in total practice for over 30 years. And I have a couple of comments about the mask mandate. I'm not in favor of it. And the reason why is I don't feel those statistics, the case numbers are accurate, first of all, because to really diagnose a patient with a disease, you have to examine that patient. It's not just a lab test that will render a proper diagnosis. So these are drive-through PCR tests. There's a lot of false positives. We have no idea if these people have symptoms or if they don't have symptoms, and they've never been examined by a medical doctor. So how can you trust these statistics? To me, they're invalid. A valid diagnosis requires being examined by a trained, qualified, licensed physician who conducts a thorough history and examination of his individual patient. Okay, and now I want to go over the idea that these masks are actually a medical intervention. Lab tests is also a medical intervention, and vaccines are a medical intervention. And only a licensed, qualified medical doctor can diagnose and treat disease. So I don't see how the Board of Health has any authority to be diagnosing and treating disease for the entire population of Beverly and recommending medical interventions. It's practicing medicine without a license. It's completely beyond the scope of the Board of Health to be diagnosing and treating illness. Now I want to talk about informed consent. This includes the patient's rights to understand the risks and the benefits of any proposed medical intervention given by a physician. You also need to give them alternative treatments. And the patient has the right to accept
Excuse me.
or decline a medical intervention.
Your 2 minutes of comment time have passed up.
Thank you.
Thank you.
Okay, our next speaker will be Mike Reardon. I think, Russ, was this the one that you were unsure of? But anyways, Mike Reardon.
I still do not have him in the list of attendees.
There is a B Reardon, and I can set that to allow to talk if this is the correct person using another person's computer.
Why don't we do that?
Okay. B, you're allowed to speak. Is this the Mike Reardon?
Oh, hello. No, I'm actually not Mike Reardon. I am
Oh.
B Reardon. So, and I wasn't planning to speak, but I can say just, I can say something just to add to the discussion.
I'm sorry, but we have a very limited amount of time, and we'd like all the other people who registered.
Oh,
to
okay,
be able
sure.
to
Well,
speak.
I'm not the person that you're trying to reach. So,
Okay. Well, thank you very much, and sorry, sorry for the interruption.
no worries. Okay.
They do not appear to be here.
Okay. Next we have Rachel, and I'm sure I'm not going to get this name right, but it's Uski. Forgive me. Nurse practitioner, MSN. Rachel K.
Can you hear me now?
Yes.
Okay. Hello, my name is Rachel Kwapniewski. I've been a Beverly resident for the past 16 years. I'm trained as a nurse practitioner and have worked in occupational medicine, public health on and off over the past 20 years. Over the past year and a half, I've been working as a COVID case manager, assisting companies with managing their employees who've become infected with or exposed to COVID-19. In the past 10 to 14 days, my workload has increased exponentially. We've had to keep hundreds of employees out of work and refer them to monitoring protocols. Companies are hurting as this is disrupting their business operations. So I am here tonight to support that the Board of Health reissue an indoor mask mandate during this current surge to prevent Beverly essential services and businesses from further disruption. Masks are an effective public health tool that are evidence-based when used with other measures to mitigate transmission, and they will help protect the Beverly workforce and our essential employees. Businesses are at risk if they cannot operate due to staff shortages. So to keep Beverly operating at a reasonable capacity, to keep our schools open and our businesses and essential services open, we need to use all the tools in our toolbox. With this virus, it is better to play offense rather than defense. We have the tools to get through this. We just need to use them all. Thank you.
Thank you. Next, we're going to hear from Paul Kruger.
Paul, please unmute your microphone.
There we go. Is that better?
Yes, thank you.
Well, thank you for allowing me to join tonight's meeting. I appreciate the clarity of the online directions, which made registering for the webinar and requesting to participate relatively easy. Tonight, I'd like to speak in favor of immediately implementing a mask mandate for Beverly as an appropriate and necessary move, at least for the immediate future. The specific problem the mask mandate is designed to address, as all of us know, is the high transmissibility of the Omicron variant, which has the likely potential for a flood of new COVID cases and for the sickness of too many of our fellow citizens to make our lives seem normal. So we need to ask, how does a community reduce the level of the Omicron variant's transmissibility? The answer that experts in the medical community tell us is by wearing masks in indoor public settings. If people wear a mask, their risk of contracting COVID-19 from others is significantly reduced. If people wear a mask when they're sick, their risk of spreading COVID-19 to others is significantly reduced. Given the high transmissibility of the Omicron variant, wearing masks reduces the number of those sick from the variant. Most importantly, on a personal, emotional level, we want our families, friends, and fellow citizens to remain healthy and safe. But also important, perhaps from a more practical perspective, if we ever want to return to something called normal, we want our fellow citizens to be healthy enough to go to work in stores, as truck drivers, train engineers, conductors, and bus drivers, as healthcare workers, police officers and firefighters, airline pilots, flight attendants, teachers, and daycare workers. We need to institute and implement the mask mandate and stay healthy so that we have a chance to return to normal. In closing, let me say that in Beverly, throughout the pandemic, we've been very lucky to have the leadership of Mayor Cahill, Health Director Burke, and the Board of Health. Leadership that continues to be reasonable and responsible. Thanks so much for listening.
Thank you. Next, we're going to hear from David Urshun.
David.
Hi, I'm sorry, I was muted. My name is David Urshan. I live on Rantoul Street, and I'm speaking strongly in favor of the mask mandate. Every abutting town or city, Salem, Danvers, Peabody, Marblehead, and Manchester, I checked their websites just before the meeting, have indoor mask rules coming into play. For the state of Massachusetts COVID information website, the 2-week COVID-19 case count in Beverly has increased from 104 on November 4th to 427 on December 30th. And I think that a 400% increase in 60 days warrants more restrictive measures like a mask mandate until cases go down significantly. One other metric, going back a little further, per the U.S. Department of Health and Human Services, there was one COVID patient in Beverly Hospital on August 1st. As of yesterday, there were 29. Again, I urge you to vote for this mandate. And I guess if that wasn't enough, the state just announced that the state of Massachusetts hit 20,000 cases today. Again, please vote for the mandate. And thank you very much for letting me speak.
Thank you. Next, we're going to hear from Kent Harrop.
Kent, if you could unmute your mic, please.
Yes, can you hear me now?
Yes.
Thank you. Thank you for this opportunity to speak. My name is Kent Harrop, and I've been a resident of Beverly since 2014. And I recently retired as a pastor after 40 years of ministry and the last 7 years serving in Beverly. Throughout my ministry in a variety of communities, I've seen what can happen when diverse people of goodwill come together for the common good. I've been inspired many times by the ability of the Beverly community to come together during times of challenge. I want to thank you as staff and volunteer leaders of the Board of Health, along with city leaders, for your service to our community during this long pandemic. Again and again, you've had the need to pivot in response to new data, and a time to pivot has come yet again. I believe the time has come to move to a mask mandate for all indoor gatherings and outside when people cannot reasonably distance. With the positivity rate in Beverly and surrounding communities dramatically rising due to Omicron and Delta, and with the regional healthcare system at risk of being overwhelmed, I urge the Board of Health and city leaders to take the step of mandating masks. I think doing so would help limit the transmission of this highly infectious disease, give people greater peace of mind, and would also be good for local business. In recent weeks, I've begun taking my business outside Beverly to communities with a mask mandate, and I would prefer to do my business whenever possible right here in Beverly. I believe that wearing a mask is a minor inconvenience to better ensure the health and well-being of workers, customers, and indeed all of us. I believe that a mask mandate coupled with an emphasis on vaccination, boosting, and testing is in keeping with good science and is a moral imperative. Thank you.
Thank you. Next, we have Judith Askenez. Hopefully I got that name right. If not, I'm sure I will know.
Yes, my name is Judy Ashkenaz, and my husband and I have lived on Rantoul Street since 2005. I appreciate this opportunity to comment, and I would like to speak in favor of the proposal that Beverly reinstitute an indoor mask mandate in response to the currently high spread of COVID in our community. Although Governor Baker has not implemented a statewide mask mandate, he has said that local officials should pursue stricter COVID protocols if needed based on local transmission of the virus. Here in Essex County, the average number of new COVID cases is at an all-time high, 2,035 cases yesterday, representing a 5 increase just from the day before. Because of the high spread of the virus, the CDC is recommending that even vaccinated people wear masks here. Between December 22nd and December 30th, the communities adjacent to Beverly, Danvers, Salem, Peabody, Marblehead, and Manchester by the Sea have all instituted or reinstituted mask mandates in response to the current surge. I'm in good health, but I'm over 70, and I will be far more likely to enter local businesses when and if such a mandate is put in place. It was really unfortunate that the Board of Health's previous effort to take up this issue was disrupted, and I hope this meeting will proceed as it has so far without incident. And further, I hope that the Board of Health will now adopt a mask mandate that will bring us in line with the efforts of our neighboring communities. Thank you.
Thank you. Next, we are going to hear from Kat Donlin.
Hi, thanks everybody. Good evening. My name is Kat Donlin. I'm an 18-year resident of Beverly residing on Winthrop Ave. Thank you for the opportunity to speak this evening. I have some brief commentary on reinstituting the mask mandates for indoor venues in Beverly. First, there is very current information on the utility and effectiveness of cloth and thin surgical masks against stopping the spread of this highly contagious variant. What is in the literature now, and I cite a current Cleveland Clinic infectious disease specialist, he's stating that unless you are wearing a tight-fitting N95, these masks are not offering other than marginal to zero benefit to the wearer and those around you. The virus can now permeate through with this very contagious variant. Second, it is important that people exercise to stay well during this time. Indoor exercising at our local gyms is being forced to wear a mask while doing so is not healthy, especially for children participating in group sports. In fact, it's dangerous. Third, bringing back this policy is onerous to business and business leaders who have already suffered so much financially. With every spike that we have seen, our small business leaders are already realizing decreased revenues as more people are staying home or canceling plans to be out in the community or dining in our restaurants. Please, let's not make them the mass police again. And lastly, I would like to make the point with respect to individual responsibility and self-governance. As I was out in the Beverly community this week, a high majority of people are wearing masks without a mandate in place. I trust that the good people of Beverly understand their own relative risk, are staying home when sick, and practicing good hygiene. With all that said, my hope is that this vote will be no on a mask mandate at this time, as the evolving science does not support it. Thank you.
Thank you. Next, we have Kendra Hewitt.
Hi, thank you guys for, can you hear me? Okay, great. Hi, thank you for having me on. I am a Beverly business owner with my husband, and I support not having a mask mandate, just like Kat just spoke about. Reason being is I believe in freedom of choice and personal responsibility. And I think that at this point, we all know that the masks are like wearing a piece of toilet paper over your face. And there is very little studies and science that supports that there is evidence that this is actually going to help the spread. We're this far into the spread, and wearing a mask today, it's not like it just woke up today and decided that today's the day we're going to stop spread the coronavirus. So I am not supporting businesses that are very on the mask mandate. I've actually considered bringing my business elsewhere when my lease is up, because of how it has been handled, where people's constitutional rights and own personal responsibility have been denied. And I think that there's many arguments on that side. And also with the statistics that you guys are reading as science, I do not think that they are from an actual reputable source of accurate numbers of what is actually going on. I understand we have a major hospital in here and that we are bringing possibly other cases from other surrounding towns, and those numbers should not be included. And if you can't know the numbers on the home test, then why are we even talking about this conversation? I think that it should be up to the citizens and the business owners. Unless you guys are going to show up, pay my rent, and support my payroll, I do not want my employees being police of our patrons. Just like someone reiterated too, it's been hard enough to survive this. I also have another location in another city, and I do deal with nothing of this. They have been so much more supportive of us getting our own choice. And I think that we should absolutely have the choice as business owners and patrons in Beverly to decide what is right for our health.
Your 2 minutes have passed. We want to have room for anyone else to speak. Thank you.
Okay, next we have Leslie Gould.
Good evening, everyone. Can you see me? Hold on. Can you see me? Okay. Thank you. Thank you. I am my name is Leslie Gould. I'm the Executive Director of the Greater Beverly Chamber of Commerce. I've been there since 2018. I really appreciate and respect what everyone is saying this evening, and I truly appreciate the fact that you rescheduled this meeting. When Boston passed their recent mandates, we immediately as a chamber sent a survey. As you know, I've been sending you updates about the mask mandate as well as the vaccination mandate, et cetera, et cetera. And we had 120 businesses, chamber members take the survey. And I just wanted to give you the very latest results with regard to the mask mandate. And they are 74.17% said that yes, they would. So this, I should also say, it said the cities. As cities and towns across the Commonwealth consider reinstituting mask mandates, would you be in favor of leaving that decision to the individual business owner? 74.17% said yes, and 25.83% said no. I feel that after having this survey and speaking to so many businesses as I do, they feel obviously that they would like to make that choice themselves, that certainly if someone, a patron, wants to wear a mask, they can certainly do that. A lot of the business owners are already wearing masks per se, if they want to. I feel that this is a highly intelligent community. We have the tools to protect ourselves, and the, patrons going, I've heard different sides. Of course, some patrons will leave Beverly, some patrons will come to Beverly, and that's a fact, depending on which way you go. We would certainly appreciate it if you could let the businesses make that choice. And if you decide to move forward with a mask mandate, we would certainly appreciate if you could give us a timeline, maybe 2 weeks, and then reconsider, so that there's a definite end game where people can say, okay, because we've been through so much, even just as a community and as a country. So perhaps that is something that you would certainly consider. Call it for 2 weeks, let's reevaluate, and then go to the next one. Thank you so much. I really appreciate your time this evening.
Thank you. All right, we have one more speaker, and that is Todd Rotundo.
Thank you, everyone, for having me. My name is Todd Rotundo. I am a resident of Beverly as well as a business owner of Beverly. I've owned business in the city for 24 years. I own a restaurant. I have seen firsthand how it's affecting us as a business. I'm not for or against mask mandates, but what truly in hearing from people is I want my customers to make that decision. I go into Stop and Shop on a daily basis, and 9 out of 10 people are wearing their masks, but that's their choice to wear their masks, as well as people coming into the restaurant. What I find conflicting right now is I have a restaurant where people come in with their masks on, but sit down to eat their food and are able to have beverages or food in front of them, and yet it's okay. So hence, for some reason, food and alcohol or water or any beverage in front of them has a magical effect that it no longer exists, this COVID. So there I'm suspect to requiring the business owners to police mask wearing. Last year, when we had a really bad rate and we didn't know what was going on, it was miserable for us owners to have to do this. We had to police people. We offended people. And yes, it will be at a point where if I choose or my employees choose not to wear a mask, I may offend customers and they may not come in at that time. Or if I require them to wear their mask and ask them kindly, they may be offended at that point as well. There's really no win or lose situation for us. Again, like I said, I wanted to state it I'm not for or against what you're going to give us for a mask mandate. I'm more for the people to make their decisions on what it is. I think we are sensible enough. I am having a little hard time with the conflicting evidence of, it's okay to be 3 feet apart in a school, and at one point it was 6 feet in a restaurant. So again, I just want to state my case as a restaurant owner where a mask mandate just doesn't make sense for every single situation. Thank you.
Thank you. Russ, do we have one more? Actually, that?
Yes, we do. We have a Victoria Jackson, who is one of the last people who had registered to speak. Hold on, and they're being promoted.
Hi, thank you. This is Victoria Jackson, and I was just going to click on my camera here. Thank you very much for having this meeting. Thank you for all the work that you've been doing. This has been just a crazy time for everybody. My company is Atlantic Lab Equipment. We're based at the Cummings Center here in Beverly. I also lived in Beverly for 13 years. My company supplies refurbished lab instruments that do COVID testing. So I spent 12 months from April of 2020 through April of 2021, working around the clock to help laboratories get set up to run COVID testing. As was stated earlier, I have not seen any scientific evidence that really assures us that these cloth masks and these paper masks are going to prevent the spread of COVID. Actually, the evidence is that they don't. They don't stop the virus. They do catch spit, which I think is helpful. And as a business owner, my business is 20 years old. It's really hard running a business. And small businesses are the lifeblood of the North Shore. They're the lifeblood of Massachusetts. We need the government to be able to allow businesses to have as much freedom to succeed as possible. The masking of children, masks reduce the amount of oxygen that people get. They increase the amount of CO2 that people are breathing. The masks are not clean. They, a lot of them, unless you're replacing them on an hourly basis. So, I wish they could do what we hoped that they could do, but I just really think that suggesting that people wear masks, I think is fine. I completely support the Board of Health doing that, but beyond that, I'm opposed to. Thank you so much.
Thank you. So that wraps up our public comment period. At this point, we would be taking.
Excuse me, Bill, I'm having trouble hearing you. I don't know if anybody else is.
No? Can you hear me?
No.
Good. All right, so we've wrapped up the public comment period. We're, as a board, going to take this under consideration, but before we do that, I think Mayor Cahill may have a few words before we get to the order of business.
Hi, Mr. Chairman. Thank you. It's good to see everybody. I want to thank you all for your service to the city, our board volunteers, our Department of Health staff, our IT team who are helping out with making this meeting work. And I do want to thank everybody who's testified who's shared comment this evening. Really appreciate the thoughtfulness. And I am very sensitive to concerns raised by folks who are not in favor of the requirement. I do, at the same time, believe at this time, with the surge we're experiencing of Omicron, that this is a necessary step. And so I just want to share a couple of thoughts with you along those lines. First, Mr. Burke shared some of the hospital data. If I could just also, I get a weekly update from, Mr. Burke shared some of the transmission and positive data. I got data from the hospital that I get each week. And today in the hospital, in Beverly Hospital, there are 50 inpatient COVID positive cases. Of those, they're not all Beverly residents. 12 are Beverly residents, but we have a total of 50 and then 2 suspected cases. And I just mention that because we've been tracking this ever since COVID started. There have been 2 peaks thus far, and we're on the upswing with Omicron. In the first peak in April 2020, the high water for COVID positive admissions was 62, according to the hospital. In the second peak, last January, a year ago now, it was 73. Today, we're at 52, and that's been on a significant upswing. We were down, as you would expect in the summer months, to 0 to 5 people on any given day inpatient with COVID. We had an upswing into the roughly 20 per day in September. That went back down to about 3 or 4 at the end of October. It's edged back up since, and since the beginning of December, it's gone from about 22, 23 inpatient a day to today's 52. And it's been ever since Omicron started hitting, it's been steady. And everything that's been forecast about Omicron is that it's really the second week of January on through the end of the month that we've been told is for the big increase to be concerned with. So when you see the numbers going both in positives and hospitalizations, I'm concerned in that sense. There's one more piece of data on positives. In the last two 14-day measurements of positives, what we see is that the last 14 days, we had 98 of our Beverly residents under 18, so our school-age kids, and then the most recent 14-day period, that's up to 154 positives. And so that really rolls right into why I think it's so important that we take this additional step right now. We need to protect our healthcare workers, everybody who sees the sicker patients in the hospital. We need to protect their loved ones at home. Our healthcare workers go home to loved ones who might be too young to be vaccinated or medically can't be vaccinated. And they go home to loved ones who may be vaccinated but have underlying health conditions that leave them more vulnerable nonetheless. We need to keep our schools open and our kids learning. We need to keep providing critical public services, police, fire, ambulance, public works. We've been dealing this week in Beverly with our trash and recycling pickup being slowed. We just had another daily meeting about an hour ago with JRM, our hauler, and yesterday through their company they had a big call out of people who are home positive, and today they had several more. And in talking with him at 5 o'clock, he had others who are going to get tested right now who are feeling symptomatic. So just the ability to deliver these core services that are so important is being very much undermined by the spread. So with that said, historically, there are a number of ways in which we fight airborne viruses. And masking seems to me, from my reading of history, to always be in that mix. So wearing masks, staying home when sick, quarantining, vaccines, keeping people's own family circles as small as they can. All of these steps are the kind of things that matter. So, and I'll say this, we're approaching 2 full years since the shutdown in March of 2020. And from day one, it became very clear to me that nothing that we can do in response is perfect. Everything we do is imperfect. So we try to do our very best to sort through all this and make decisions that are going to try to move the needle in the right direction. And from all that I understand of the data and the studies that consistently support mask wearing as a way to slow, as a way to prevent spread when it comes to airborne viruses, I believe that's the case here. I do want to just share a couple thoughts with you. If in fact you do pass this order, one thing I'd suggest is you do look at the duration. Everything suggests that Omicron is going to spike for the next several weeks. And if the experience in some other countries who've been ahead of us is to be followed, then we hope on the other side that it'll quiet down quickly. But it seems that we've got several weeks ahead of us. So setting a duration and revisiting, and that's your discretion. And then I want you to know, and I want people who are watching and listening to know that if you do pass, the city is ready to facilitate the kind of communication that our local businesses need. We will get electronic versions of the signs that need to go in at entryways. We will walk around to businesses over the next couple to several days and bring printed paper copies of those. We also are making available a supply of masks for any Beverly business that wants. We can deliver surgical masks for their use. They can put them out inside the door for a customer who maybe didn't realize or forgot and puts one on when they come in. I think it's also important that our local business community knows we are not expecting them to police this with their customers, with their clients. We do expect or should I say, you folks on the board, given what you have drafted, if this does pass, we will expect that employers will ensure that their staff their employees are masked. Other than that, what we did the last time when there was an indoor mask mandate, a year and a half ago to more recently, what we did in Beverly was we put 2-person teams of health inspector with a local Beverly police officer. And the goal and the focus was to go into our businesses for the purpose of educating, informing, and reminding, and only enforcing when absolutely necessary. And so in this way, we would hope that businesses would not feel that burden of being asked to enforce something. I also wanted to let you folks know, because there are heartfelt concerns about negative impacts on business from things that have happened and potentially from this. We have been working for some time on putting together a business relief program in Beverly using some of our ARPA funds. We met yesterday with some of our local and regional business leadership, and we will meet with them again tomorrow to get their input on trying to put a program together that can provide some financial help for local businesses, something we're hoping to be able to provide more details on very soon. So just in summary, mask wearing has always helped. I believe that it will again. Again, not perfect, not a guarantee, not a cure-all, but wearing masks feels like a necessary tool while the Omicron variant is surging so quickly up. Thank you so much again for all you folks do, and I wish you the best in this deliberation. Thanks.
Thank you, Mayor. At this point, I want to see if any of the board members have any follow-up questions, comments with respect to the order and any of the testimony that are public comments that have been provided here tonight.
Sue, go ahead, please.
Mr. Jordan?
I think Sue raised her hand first. Please feel free to call on her. Yeah, thank you.
Thank you, Bill. I actually just first of all want to thank everybody who spoke tonight. I think it's very helpful for us to be able to hear input from the public, from business owners, from individuals. And I also want to thank the many people, which was, fivefold over, who spoke tonight, who submitted written comments. To the best of my knowledge, every comment that was submitted to the city was provided to us, and I have read every single one of those that was submitted. Many of them were very well stated and politely written and informative. I appreciated that very much, and it was instrumental in having that information, in addition to the research that I have done myself, and I'm sure my fellow board members have done, looking at information by the CDC, by the state, in particular the COVID dashboard, the health department. So I just am very appreciative of what everyone has provided. And I guess the one comment I want to make is, many people either in writing or tonight throw out numbers. There's so many numbers out there. And regardless of where you stand, you can find the numbers that support your position. And I think we have to all remember that. And, there's many more that weren't spoken tonight. The fact that Beverly is 74% vaccinated already is a very powerful number. So it's challenging, and I think we all have our opinions. And as we get to the discussion of this vote, those opinions will be made known. But there's just a lot of data out there, and just many ways to support whatever your position on the argument is. So thanks, Bill.
Thanks, Sue. Justin.
Thank you very much. I'd like to just echo what Sue said. I think that I took a lot of time to read all of the public comments that were submitted online, and was really grateful for the variety of opinions and the diversity of opinions that were presented to the city and to the board to review. Clearly, mandates are an extreme measure in many cases, and so I don't think that this decision is taken lightly one way or the other. And so I just would like to emphasize, the careful consideration, at least that I've been putting forward, and hopefully will be demonstrated in our discussions.
Thank you. All right, at this point, I want to call the order to a vote. Can I, and I'll entertain a motion from the board as to any proposed motion that they want to put forth.
So Bill, I would like to make a motion that we do not issue the mask mandate as written, and instead we take a step forward to issue a public health advisory urging continued vigilance and encouraging the public to take steps to protect themselves and others, including getting vaccinated and boosted, wearing masks, testing, and staying home while sick.
Can I get a second to that motion? I guess I will second it, but for purposes of discussion only. So we have a motion on the table right now to have a more of a discretionary mandate.
Yes, to not issue a mask mandate and issue a public health advisory instead.
Okay. Any other comments?
May I make a comment on that?
Sure.
I think the challenge is that the state already has a public health advisory in place that it sounds like we would be duplicative of in this regard. And yet we're still in crisis mode despite the state advisory. So my concern is that it doesn't add any additional benefit to the current state of public health.
Okay.
Okay, well, and could I also comment, Bill? I think you're correct. We would just be enforcing or duplicating what the state has already done and kind of taking a stance that we agree with their approach. I am opposed to mandates for many of the reasons that, people have presented both in writing and verbally tonight. I think that one size does not fit all, not for individuals and not for businesses. And I think we've heard some strong arguments about that. I also think that we're not in the same circumstances that we were in the spring of 2020. At that time, we were operating under a declared public health emergency. It was declared by the state, it was declared by the mayor, and it was declared by us as a Board of Health. And that is not the case right now. 74% of Beverly residents are fully vaccinated, and there are many people who have, as we've heard the numbers, have tested positive. And the argument is that those people who have been positive for COVID have some natural immunity, which in all the discussions I've heard, nobody seems to take that into account, the level of protection offered by that natural immunity. I also think that testing is more readily available now. I will acknowledge that it is still challenging to be tested. You order a test kit online, it can take weeks to get. You can wait in long lines to get tested, but it's something that was not available to us a year ago. It's available to us now. And I think that this new variant is more transmissible, but less virulent. And, that is the natural course in my understanding of what viruses do. And I think it's doing what it does and what we would expect it to do. And then lastly, I think the enforcement is a real issue. And I think that it does fall on the businesses to enforce it. And if, as the mayor had said, that the goal is to not require the businesses to do it, but to have a representative of the health department and the police go door to door and educate and encourage, and that to me is not a mandate. that why are we putting in a mandate that is not intended to be enforced? That is, in fact, an advisory, and that is what I think that we should do. So again, I feel that we are going too far with this. I think, again, looking at the numbers, we saw the same spike this time last year. It spiked at this time last year. It spiked in the period of January 3rd through January 16th. I don't have my glasses on. So I think we are at the peak. I think we're going to start to see it coming down. I think that we have to not focus quite so much on the numbers of the cases, how many people are infected, but the results of those infections. How sick are these people? And, are we at the point where it is becoming a more common virus like the cold or the flu, where people just stay home, stay away from people, heal themselves, and then go back to work? So I am in favor of vaccinations. I'm in favor of masking. I'm in favor of all the steps. I am just not in favor of mandating it as a community. So that's where I stand.
May I respond? Is that
sure?
Thank you. I mean, I thought a lot about advisories as well as I was sort of grappling with this over the past, getting ready for the meeting. I think maybe just to take a step back in regard to some of the public comments we've heard, the CDC has a great advisory that was released December 6th on the efficacy of masks for reducing transmission of COVID-19. And there are at least 18 published studies available through the CDC, through a variety of institutions, many of which have looked at the utility of mask mandates in municipalities and states and public buildings, and essentially universally showing an associated decrease in transmission in the community. I completely agree, Sue, that this strain seems to be less virulent. However, the current infection rate has decimated the workforce in hospitals, where as many as 40+% of ancillary staff are missing. And we've got National Guard in place thanks to the governor, but that actually still is not able to replicate the usual requirements of the specialized training that nurses and medical assistants and phlebotomists have. Our municipal services are at risk, at least of timely delivery, based on what the mayor has said. And I think that is affecting us enormously. There was significant discussion at the beginning of the pandemic about the economic effects of the pandemic. And frankly, I think I'm not an economist, but I can't imagine that we're not in a similar threat economically based on how many members of our workforce are coming and how many businesses are unable to conduct routine business. On the radio this morning, I heard a very large fire department in Massachusetts talking about the number of firefighters out ill and the fact that they may have to reduce the number of houses that they're going to for emergency calls because they just are spread too thin. So I think although we're not putting people in ICUs with severe illness in the same way, we still have a very high transmission that's impacting us. And, my sense is our job is to protect the vulnerable and to protect those individuals who are not vaccinated through, either their age, because the young people still are not able to, or personal medical problems or illness that keeps them from being vaccinated. And I think we heard from many great commenters tonight. One of them said, masks are a minor inconvenience, but to do that, I think, contributes to the greater good of those vulnerable people. And we are largely vaccinated, 79%, but the numbers for people less than 30 are pretty abysmal in our city. So the individuals who are working in our supermarkets and in various locations around town, the 20s to 30s are not vaccinated in nearly the same rate as those who are 30 and up. So I remain in favor of a mandate, recognizing that it is an extreme measure, but I would ask that we entertain an amendment to the order as written with an expiration period of 4 weeks. And we could rediscuss at that point whether it needs to be extended or not.
I think we have to take the vote on the motion before us.
Sorry.
Which is, I believe, Sue, that you made a motion for an advisory, not a mandate.
Correct.
So we need to take a vote on that. And the city solicitor's office, feel free to step in. But I think we need to take a vote on the motion before us and see where that goes. So I'm going to do a roll call. I'm going to ask Sue, please state your position, your vote.
I vote yes.
Justin?
No.
I'm going to say no too. So we now have to entertain a new motion. And I put it out there for either of the board members to come forth with a motion with respect to the order that's before us.
I would like to move to add an expiration of the order in front of us for 4 weeks from today, or from tomorrow, which is the date set for initiation.
You have a second? All right, I'm going to second that. Just to put it up for discussion. Any discussion?
If I may, I think Sue makes a very good point. We're in the midst of a spike, like we've seen previously. The numbers are rising exponentially. But if we look to other countries who have suffered through recent surges of Omicron, in many ways, they're relatively abbreviated surges. And I think that we've heard really great comments from the public and from business owners with concerns about a mandate coming into place. And so I think putting a limitation on the mandate rather than having it open-ended hopefully will, as we were asked by the Chamber of Commerce or by the Massachusetts business leaders, I think that might provide some additional level of, or at least less displeasure for those people who are against the mandate.
Any other comments?
My previous comments still stand. I am opposed to a mandate. I do think that putting a time period on it is helpful. I still think it's the wrong thing for us to do.
Okay, I'm going to bring this to a vote. And the vote motion on the table is to adopt the order, however, subject to a 4-week time limitation. Sue Higgins, how do you vote?
I vote no.
Justin Jordan?
I vote yes.
How do you vote? You vote yes. I vote yes as the chair, Bill Alpine. So the motion will be a mask mandate for a 4-week period, subject to reevaluation by this board at that time. That convenes tonight's meeting. Can I get a motion to adjourn?
Motion to adjourn.
Second. Thank you very much.
Thanks, everyone.
Thank you.
Thanks all.